What's your blood type? A, B, AB, or O? Most people know their blood type from a test they took decades ago and never thought about again. But here's what almost nobody tells you, and what took researchers at Harvard Medical School years to confirm. Your blood type is one of the most significant genetic predictors of your heart disease risk. And if you're over 50, that information could quite literally save your life. Today, I'm going to tell you exactly what the science says. For every blood type, stay through to the end. The results are not what most people expect. I've spent over 2 decades practicing internal medicine and cardiovascular health. And blood type is one of those factors that gets almost no attention in routine checkups, even though the research connecting it to heart disease risk has been building for over 30 years. Today we're going through each blood type, AB, AB, and O, what the evidence actually says about cardiovascular risk, and the specific steps each group should take to protect themselves. Let's start with the science. Your blood type isn't just a label for transfusions. It reflects a set of proteins and antigens on the surface of your red blood cells, and those same proteins appear throughout your cardiovascular system, including in the lining of your blood vessels. These proteins influence how your blood clots, how much inflammation your body produces, and how your vessels respond to stress. All 3 of those mechanisms are directly tied to your risk of heart attack and stroke. A landmark study published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology, following over 400,000 people, found that non-O blood types had a measurably higher risk of coronary artery disease compared to blood type O. This is not fringe science. This is peer-reviewed, large-scale epidemiological research. Let's go through what it means for each type. If you are blood type A, and roughly 40% of people are, here is what the research shows. Type A blood is associated with higher levels of LDL cholesterol, the kind that builds up in arterial walls. Type A individuals also tend to produce higher levels of cortisol in response to stress, and cortisol is one of the most damaging hormones for cardiovascular health when chronically elevated. A study from Uppsala University found that Type A individuals had a statistically higher risk of heart attack compared to Type O, even when controlling for diet, weight, and lifestyle factors. What this means practically: if you are Type A and over 50, stress management is not optional. It is a cardiovascular intervention. Chronic stress in a Type A body creates a biochemical environment that accelerates arterial damage. Key risks: higher LDL, higher cortisol response, increased clotting tendency. Priority actions: stress reduction, regular LDL monitoring, anti-inflammatory diet, limit processed foods and refined sugar. Blood type B is the least common of the 4 major types, around 10% of the population. The cardiovascular research here is more nuanced, but there are important patterns. Type B individuals tend to have a more reactive immune system and a gut microbiome composition that differs significantly from types A and O. This affects how dietary fats are processed and how inflammatory signals travel from the gut to the cardiovascular system. Some research suggests Type B individuals may have a higher susceptibility to certain viral and bacterial infections that can trigger inflammatory responses, and chronic low-grade inflammation is a direct driver of atherosclerosis, the buildup of plaque in arteries. Key risks: gut cardiovascular inflammation pathway, immune reactivity. Priority actions: prioritize gut health, fermented foods, fiber diversity, avoid prolonged antibiotic use without probiotic support, and keep inflammatory markers like CRP monitored annually. If your blood type is AB, I need you to pay close attention here. AB is the rarest blood type, only about 4% of the population. But when it comes to cardiovascular risk, it carries the highest burden of the 4 types. The Harvard study I mentioned earlier found that Type AB individuals had a 23% higher risk of heart disease compared to Type O. That is not a small number. Type AB blood is associated with elevated levels of a clotting factor called von Willebrand factor, which increases the tendency of blood to clot inappropriately, a key mechanism in heart attacks. B types also tend to have higher levels of systemic inflammation markers. Key risks: highest clotting tendency, elevated von Willebrand factor, highest heart disease risk among the 4 types. Priority actions: omega-3 fatty acids are especially important for AB types, regular blood pressure monitoring, avoid smoking entirely, and discuss aspirin therapy timing with your doctor. Type O is often called the protective blood type, and for cardiovascular disease, the data does support that framing. Type O individuals have lower levels of von Willebrand factor and tend to have less arterial inflammation than the other 3 types. The large-scale studies consistently show type O has the lowest relative risk of coronary artery disease. But here is the important caveat: lower risk does not mean no risk. Type O individuals have a higher susceptibility to certain ulcers and bleeding events due to lower clotting tendency. And cardiovascular risk from lifestyle, smoking, poor diet, inactivity, high blood pressure, overrides any genetic advantage completely. Key risks: ulcer susceptibility, bleeding tendency. Priority actions: don't be complacent. Lifestyle factors dominate genetics. Monitor blood pressure, stay active, and keep annual checkups. Here is what I need every person watching this to understand, regardless of your blood type. Genetics loads the gun. Lifestyle pulls the trigger. The blood type research identifies relative risk, meaning type AB carries more baseline risk than type O. But a type AB person who exercises regularly, eats an anti-inflammatory diet, manages stress and doesn't smoke will have better cardiovascular outcomes than a sedentary type O who does none of those things. Your blood type is information. It tells you where to focus your attention. It does not determine your outcome. The 5 factors that dominate cardiovascular health after 50, regardless of blood type, are blood pressure control, LDL cholesterol, blood glucose, physical activity, and smoking status. Here is your personalized starting point. Type A. Get your LDL checked. Add a daily stress reduction practice, even 10 minutes. Reduce refined sugar and processed food. Type B. Focus on gut health. Add fermented foods. Get your CRP, C-reactive protein, tested annually. It's the best marker for low-grade inflammation. Type AB. Take omega-3s seriously. Fish oil or algae-based. Monitor blood pressure at home weekly. Talk to your doctor about your clotting risk profile specifically. Type O. Don't use your blood type as an excuse for complacency. Stay active. Your lifestyle advantage is the one you build, not the one you were born with. All 4 types. Get a full cardiovascular panel done this year if you haven't had one in the last 12 months. If this gave you something useful, hit like. It helps more people find information that actually matters for their health. Subscribe so you don't miss what's coming next. I'll be covering what your resting heart rate number is really telling you about your heart age. Most people glance at it and move on. It's one of the most underused pieces of data you carry with you every day. Take care of yourself. See you there.